On this video, we'll be talking about prostate problem as a male issue. The prostate gland is part of the male reproductive organs and it secretes a fluid that mixes with semen on ejaculation. The prostate gland is nestled just below the bladder and surrounds the urethra, which is the tube that both semen and urine flow through. There are three main prostate problems that men can suffer from, and these are prostatitis, benign prostatic hyperplasia (BPH), and prostate cancer. How can a man tell if he has prostate problems? One way of determining whether you have a problem is by having regular prostate examinations, and this is especially important for men who are aged 50 or older. Of course, it also helps if a man is able to recognize the symptoms of prostate problems. Some people assume that prostate problems are something that only older men have to deal with, but this isn't actually true. Prostatitis is a common condition that predominantly impacts younger men, and it is the medical name used to describe an inflamed or irritated prostate. The symptoms of prostatitis may include a burning sensation while passing urine, frequent urination, fever and fatigue. There are two different types of prostatitis. Bacterial prostatitis is caused by the presence of bacteria in the prostate gland, and it is usually easy to treat with antibiotics. Non-bacterial prostatitis is a little more difficult to treat. Dietary amendments and warm baths are usually recommended, but there is no set remedy that works for every individual. If a man has non-bacterial prostatitis, more serious conditions such as cancer will need to be ruled out. Benign prostatic hyperplasia is probably the most prevalent of all prostate problems, and it is common in men aged 50 or older. Simply put, BPH is an enlarged prostate gland, and it is caused by an excess of a male hormone called dihydrotestosterone. This hormone also causes excess body hair and loss of the hair on the head. An enlarged prostate puts undue pressure on the urethra, and this causes symptoms such as the frequent need to urinate, a weak stream, dribbling or leakage after going to the bathroom, and the feeling that the bladder is never quite empty. Men with BPH often need to get up several times during the night in order to urinate, and this can lead to lack of sleep. BPH is not considered a serious medical condition, but it can lead to more severe problems such as urinary tract infections, bladder stones, kidney infections, and even cancer. There are several treatment options available for BPH. There are prescription medications available to shrink the prostate gland and relieve the pressure. There are also non-surgical medical procedures that remove a portion of the prostate. Some herbs and supplements are purported to prevent or treat prostate problems such as BPH2. Saw palmetto, stinging nettle extract, specific amino acids and fatty acids such as omega-3 and 9 are all beneficial for men with prostate problems such as BPH. Prostate cancer is the most serious of all prostate problems. Fortunately, it is also relatively rare. The symptoms of prostate cancer are very similar to those of BPH. That is why it is very important to see your doctor if you experience symptoms such as frequent urination, weak urine stream, blood in the urine, or a feeling that you cannot completely empty your bladder. Treatment options include chemotherapy, radiation therapy, and surgery. Visit our website for more info on prostate problem male issue at prostate.healthomni.com.